Do you find yourself bringing charting home on the evenings and weekends? Is your EMR inbox in the triple digits, overflowing with results and paperwork? Are the overwhelm and stress palpable, weighing on your shoulders? Do you wish there was an opportunity to get the coaching and accountability you need, the tips and tricks, the framework to get your work done at work and to lift that weight off your shoulders? Well, good news. The Charting Mastery course and group coaching program are here for you. Get on the wait list so you are one of the first to know when the next cohort comes around. I can't wait to see how this makes a difference for you and your charting. Learn more and enroll today at coaching.mededwell.com/charting. That's coaching.mededwell.com/charting. You're listening to the Wellbeing in Medicine podcast, helping physicians and others in medicine thrive. More than simply supporting your wellness, you will be empowered to take back your agency and optimize your charting, mindset, and more. I'm your host, pediatrician and life coach, Dr. Ryan Stegink. Welcome back to another episode of the Wellbeing in Medicine podcast. I'm so excited that you're here investing in your well-being and acknowledging that you are a whole person. And you don't just separate all that out just because you walk into the office, into the hospital, into the operating room. So today, I'm going to be bringing you a throwback episode. I recently passed 5 years since the miscarriage of my boys, and it was a really hard time in my life, and I miss them even now, and I just wanted to bring this reflection to you from a couple years ago when I just said, grief is hard. Grief is hard, and so many of us go through it. We have hard times. We have loss. Our patients go through these same things. And while I can't identify or empathize with each particular loss because I haven't walked that journey, I can still walk alongside and say grief is hard. And caring for the well-being of ourselves and our patients, it really matters to acknowledge these things. And to say that it's okay to not be okay. So I want you to take a listen to this episode when it was previously the MedEd Well podcast and just say this is important for well-being. And so take a moment after listening and reflect on what you can take away, how you can be more sensitive, how you can acknowledge the pain that you have or maybe currently are experiencing so that you can show up better for yourself, your family, your patients, and those around you. Thanks for listening. Let's dive in. Your wife almost passed out. We're taking her to the emergency room. You need to come down here right now. My colleagues take over for my afternoon clinic as I frantically drive downtown. Is she going to be okay? Stick around for the rest of today's episode to hear the rest of the story and more of my journey, and then how you can walk this journey of grief alongside others. So today, we'll be talking about grief, loss, and coping with death. It was a frigid January morning, a Wednesday, the coldest of that winter. I warmed up the car for my wife. She works as a nurse and has 12-hour shifts. We were expecting twins. She had maybe a little bit of pain the night before, but it pretty much resolved. So she headed off to work. I headed to work, and it was understandably slow given that the temperatures were below 0 Fahrenheit, maybe a max of single digits. Many of the parents, especially with young children, were rescheduling a lot. Over the morning, my wife texted and said her pain had come back. She'd called her OB. She had an appointment coming up that afternoon. Later that morning, she was waiting for a colleague to give a report. As the pain became contractions, her colleague said, "You don't look so great. Let's take your blood pressure." It was low, and they whisked her off to the ER. I get a phone call from the charge nurse. "Come now." I leave clinic, race downtown, and I get to see her. We're both so scared. I hold her hand, her IV in place, and we hear the baby's heart rate on the ultrasound. It was beating along nice and fast like it should. Then suddenly, the bed fills with fluid as our hearts sink. We know what this probably means. An ambulance transfer, a stop in the ER at the second hospital before finally making it to OB triage. The resident comes over, does her ultrasound and exam, and sees a tiny foot. "You're going to meet your babies today," she said gently. "I'm so sorry." A few minutes later, we met her babies, twin boys. We hadn't even made it that far to find out boy or girl before then. We marveled at their perfectly formed little bodies as we wept. Their tiny frames barely larger than our hands. We named them, spent time with them, and shared tears with a few local friends and family who were able to visit and meet them. The nurses made an amazing memory box and took photos of our boys with little felt bears that couldn't have been more than 1.5 inches tall. Those are such sweet memories of our boys. Thus we began our journey in the cold ocean of grief, waves crashing over us. Though buoyed by my wife, friends, family, and faith, this has been the hardest journey of my life thus far. So on this journey, I've learned things about grief, about myself, and some things that are helpful in coming alongside those who are grieving. So first, things that I learned about grief. The hospital told us, but it took time to see that grief is nonlinear. There will be ups and downs, forward and back, all over the place. And different things will be triggers for this grief. For me, a few weeks after, we went for a walk in a special park nearby. And I just burst into tears knowing that I wouldn't be bringing my boys there for a picnic. Another time, a few months later, we went to see a movie. It was based on a true story, inspirational movie where someone was saved through the ice, but when the ambulance sirens were playing, it just brought me back to when I was rushing downtown. I couldn't take it. We had to leave. Yeah, for my wife, sometimes being around others who were pregnant, young children, twin boys at the park. It's certainly changed over time, but some of these things are still hard. So in grief, a partner or other family members may experience the grief differently, whether it's losing a spouse, a parent, a sibling. And these waves of grief may be more difficult at different times. Certainly, anniversaries will often be hard. Whether it's their birthday, the due date, some other special time of the year where you miss them, where you miss having them around, where you miss those memories maybe you didn't get to make. It's mourning the loss of the person while reflecting on those experiences you shared or that you never did. The grief, for me at least, doesn't go away. It's about taking that next step in life while not forgetting and not stopping the love that I have for them. So first, things that I learned about grief, and then second, things that I learned about myself. First, tears are good to let out. It can be really hard at times, but good. I love my boys. I miss them. Not everything is logical and rational. Something this physics major knew with my head, but now with my heart. Another thing I've learned about myself is that it's really important to process feelings. It's been really good for my wife to see me cry. Early on, we would ask, "What was hard for you today?" Honestly, I need to continue to lean into this and share when things are hard and check in with my wife, because even now, a couple years later, these things are still hard sometimes. And then checking in with those close to you, whether it's family or friends, just saying, "Hey, I'm struggling with this." Another thing I've learned is the importance of community. Those who know me, that I trust. So if you're in this situation, who do you have around you? Whether it's a partner, family, or friends. It could be others who have walked this particular journey before you. My wife's found community with others here locally, but also some online communities. For me, it's been particularly helpful with a few guys that have checked in on me whose experience has been similar. I've also learned the importance of asking for help. It could be meals. We had people bring us meals, give us gift cards. It was super helpful to not have to worry about that regular logistical piece of daily life. Could also be rearranging things that might be too difficult in the moment. If it's not going to cousin's birthday party or holding on to that holiday card until you're able to talk with someone who that may have been triggering for if you sent that out. Also, getting help includes going out and seeking out counseling if needed. I personally have found that beneficial for me. I've also found that it's easy to turn inward. We need to process these things and have community of some sort, even for introverts like me. So through this journey of loss and grief, I've learned first more about grief. Number two, more about myself. And number three, I've had the opportunity to reflect on what others might benefit from, to understand how to support and care for, come alongside those who are grieving. These can apply to coming alongside friends, family, and patients, and it includes discussion both of what to do and what not to do. So first, the list of don'ts. Many of these are from experiences that I've had. Please don't do them. So first, don't tell me that they're in a better place. You may or may not know that, and regardless, it's not helpful. It's not helpful in coming alongside. And don't even think about going further down the, well, at least, whatever the case may be, well, at least you had this time with them. Well, at least you could have other kids, that you could get pregnant again. You don't know that. And you can't control the future. And it really minimizes the loss and the hurt that someone is feeling. Additionally, don't presume to understand how someone else feels, even if you went through this similar situation. Don't add pressure or expectations on their grief. You should be over this. You should be farther along by now. You're overreacting. You're not over it by now? It's been how long? Those things are just extra weights that just eat you up inside when you're grieving. So don't do certain things. Don't say certain things. But if a friend, a family member, a colleague, or a patient is grieving, what could you do? You can just sit there, silently, giving the gift of your presence. You can say, I have no words. Just being quiet and sharing tears with them. I found that so helpful when people would just cry with me and give me a hug. Yeah. Other things that you could ask would be, what would you like me to know about that you want to share about your loved one? What was their name? Did you name your baby? Those things are a few possibilities of how to respond. Certainly not comprehensive, but it's about presence, care, and thoughtfulness. Being there. Now I want you to take a moment to reflect. To reflect on when you have gone through grief in the past. What resonated with you from the lessons that I shared? That grief is nonlinear. The importance of sharing feelings to process them. The importance of asking for help. Maybe some of the do's and don'ts about responding. What other lessons have you learned from your own experience? Now I want you to take action after this episode, from lessons and mindset toward action. Share one thing that you learned, something that you do differently in responding to grief, or maybe how you would think differently if you were going through this situation again. And then tell maybe a trusted family member or friend. Regardless, I want you to know that though we all go through this at different times, reach out for help. You're not alone. Thank you so much for joining me here on this episode. Please share, leave a review, and subscribe. I really want to help others with their wellness. And so I hope that by sharing part of my story, you can be encouraged to reach out to others if you're currently struggling, or if someone around you is going through a hard time. Thanks for all you do. Please come back and join me for another episode. Have a great day. Whether you feel like you're struggling with your charting, just doing okay, or for the moment seem to have it all together, I want to invite you to take my 2-minute free quiz, the Charting Efficiency Checkup. It's designed to help you learn more about where you are and give you some resources that can help you continue to move forward and support your own well-being in medicine. Head on over to mededwell.com/quiz to get your results today. That's mededwell.com/quiz. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEd Well podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEd Well podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEd Well podcast, and have a great day.